Here we are. How are you?
I'm doing well, excited to be here at the MedTech conference.
Yeah, this is one of the better ones where you and I were just chatting before we went on. It's like you can get to talk to your peers here and have very little sort of distraction. You see that in the dinners, you see that in the meetings. It's just pure here.
Yeah, and it's just an opportunity for us to talk about like what's really going on in our industry and
Yeah.
what we could do together.
Yes.
Healthcare is a team sport, and I would say this is a great, you kind of see that in action here because at the end of the day, we're all trying to do the same thing, and we're all trying to advance care for people and solve some of our biggest healthcare challenges. And so it's such a great forum to be able to do that. We don't have that opportunity all the time
No.
because on a daily basis, my team is duking it out, right?
That's right. That's
Outside
right.
the cath lab or
That's
the
right.
OR.
You guys are
but-
throwing elbows.
Yeah, whatever. But at the end of the day, we're trying to drive access and help improve outcomes for people who need it. So.
Well, Abbott's had a great year over the last 12, 18 months. And I've been really watching the premier franchise. One of the premier franchises you have is MitraClip, right? Continues to be the platinum standard year in, year out, doesn't create space for anybody else unintentionally. And now that technology is starting to transition a little bit into tricuspid. So there's been some good clinical data there released, and certainly we need some solutions in that area.
Yeah, so we're really excited. So thank you. We feel good about our performance at Abbott, not just the last year, but the last several years. And we obviously played a really important role during the pandemic, in particular because of our role in COVID testing. And it's nice now that the worst of the pandemic is behind us, and we're really talking about innovation. And I think this is like tricuspid and TriClip in particular is a great example of how my team stayed focused during the pandemic and continue to advance innovation and advance a really important landmark clinical trial despite all of the headwinds, and there were many. And so, yeah, we did share the data from our Triluminate study at ACC, which was the first time we prospectively looked at an intervention for tricuspid disease. And it's amazing how it's really called the forgotten valve for a reason, because it's generally not treated because the surgical procedures is pretty risky, and therefore people suffer. And it's the symptoms, you talk to patients who suffer, and it's meaningful. And so we've started commercializing outside the U.S., in particular in Europe, and it's going very well with TriClip, which, as you said, is a product that's based off the MitraClip gold standard device. And we're in the midst of discussions with the FDA about review and approval.
Yeah, and the legacy, the trust, the outcomes from the MitraClip are just phenomenal in the marketplace. But as we talk about structural and all those solutions coming out, we're also starting to graduate people downrange, which is a good and a bad thing, right? We're getting people healthier, living longer. But
to be clear, Joe, that is a really good thing.
That is
right?
a good thing.
That's a good thing.
That's a good thing, right? But we're pushing them down to heart failure now,
Yeah.
right? And Abbott's gotten really aggressive in that space as well.
Yeah.
Right? So between CardioMEMS and bringing that on and sort of catching the patient before they're a patient and finding those subclinical signals that allow us to intervene before they have to be put into a hospital.
Yeah.
Is that a focus?
Yeah, it is a focus. So I would say we look at it across the patient care continuum, and with the acquisition of St. Jude a handful or so years ago, it really did fill out the whole portfolio from the sort of earlier stage heart failure where maybe a patient who has a pacemaker or defibrillator to something like a MitraClip intervention to, maybe CardioMEMS to help keep people out of the hospital, and people with heart failure unfortunately end up there quite a bit. It's a difficult disease to manage. And then ultimately, as you know, we have our HeartMate 3 platform. So that's the left ventricular assist device, which is a very solid alternative to transplant, and sort of everything in between. And to your point, like if we could intervene earlier and predict when people might decompensate, that's what we're doing with CardioMEMS, right? Which is the pulmonary artery pressure monitor that people once they're diagnosed with heart failure, oftentimes after a hospitalization, we say, okay, we could manage them better. So instead of waiting until they decompensate and end up in the ER or end up in the clinic and ultimately sometimes end up in the hospital. Let's monitor that patient and maybe they need to change their meds. And so it's as simple as an alert goes off in the physician's office, and ultimately it'll be the patient who gets that information, and then they can act on it themselves. I mean, how empowering for people with heart failure. So, but you're right. We need to move all of this much earlier because we have all that data. We have the inputs to, and what we really need is like the predictive analytics around like who is at risk, and how do we identify those patients? They're in the system today. You talk to any healthcare, system or hospital executive, they know those patients are there. It's just a matter of getting them, referred and managed appropriately, and that unfortunately doesn't happen for heart failure. So we have work to do collectively as an industry. We have work to do as Abbott.
And though with your data sets and with your knowledge on that heart failure space and the sort of the on-ramp of that patient into that population, to have that predictability, and maybe it's not a surgical procedure like CardioMEMS, and I'm sure that the organization is looking at how do we do that non-invasively, and either a wearable, or do we need such a high fidelity signal? If we know somebody's predisposed for it because of a previous procedure, and we know that lifestyle may have them down there, do you foresee that becoming an external device sooner than later for a franchise like Abbott?
Yeah, so I would say we already have something in the works. I think it's a huge unmet need, an opportunity to improve costs and, improve outcomes, right? Like lower cost, improve outcomes, that's usually a winning strategy. And so it is taking things like, wearable sensors and combining it with, other data points and kind of pulling it all together so that we're translating all those disparate data points to information and ultimately actionable insights. So that's absolutely the direction we're going. And how do we kind of weave together or connect all the data that is out there to make sense of it all? And I think that's the challenge right now, is that it's not like there aren't people who are really well-intentioned and who don't want to identify it earlier. It's just complex. And heart failure patients, more than probably any of the other patient populations we treat, are some of the more complex and can be quite fragile if it's not managed appropriately.
Yeah, and it becomes a very, very heavy load on the healthcare continuum.
Yes.
Because what is it, statistically 50% of patients who enter heart failure, you lose them in 5 years.
Yeah,
I think that's what the number is.
Startling.
Yes.
And we can and we should do better.
So I want to shift a little bit, but still stay in that area, the changing centers of care right now.
Yep.
Right, we're starting to see healthcare go to the ASC model and the at-home model. So especially for heart failure, so chronic care, right? So when we think about cardiovascular health and we talk about heart failure, those certainly fall within the big categories of chronic disease, which I think is about 45% of our population has at least one chronic disease. So how are you thinking through this ASC model as we look at cath labs moving into that area and other sort of centers of care away from the hospital? That's a brand new dynamic for us in the healthcare industry.
Yeah, and I would say it's core to my portfolio within Abbott, which is all about chronic conditions. So I have cardiovascular, I have diabetes, I have chronic pain and movement disorders like Parkinson's disease. And so that's really our focus. And we have to be moving outside the four walls of the hospital. So we don't have the capacity. It's not the right thing for patient care. Like, we should be able to meet people where they are. And whether that be in an easier to access setting like a surgery center or physician's office, or in some cases with remote monitoring and follow-up in the office setting. And those are the kinds of things that we're working on really across the board. But it is changing the way we approach things, because I think historically, as an industry, everything happened in the hospital, in the operating room, or in the cath lab, right? And so now it's really kind of rethinking who are those customers, how do we call on them, what are their needs, and their needs are very different. So a hospital is going to have more access to capital, for example, versus a surgery center or an office-based lab in a physician's office. They're not going to have the same sort of resources, and they don't have the same sort of space. It's like simple things like that some of our navigation systems, for example, or capital equipment, they need to be miniaturized to fit into the setting of care. And then ultimately the at-home is really where we think so much of chronic disease management is going. It's the right thing for the patient. It's the right thing for the provider because they can meet people where they are, and that ultimately that becomes the right thing for the healthcare system and for Abbott.
And when you think about that ASC model, what's going to be fascinating to watch is you've got that. Right now when we sell into a hospital, for the most part, it's an institution.
Yeah.
It's predictable how we get through that value prop,
Yeah.
sit with the committee, get the CapEx request in, who's going to champion that through. ASCs now you have different
We have different stakeholders altogether,
PE,
right?
surgeons, hospitals,
Yep.
price points, CapEx, SaaS model, per click model, all of those things. What a crazy time in healthcare.
Yeah, which is an exciting time. I think we're really moving beyond the kind of traditional, here's my medical device, it costs this much, will you buy it, to like I'm offering a solution and really coming at it very, very differently. And I think things like AI and machine learning is going to kind of even cause us to think about different business models as well. And maybe it is a software as a service or things along those lines, which are allow us to almost risk share, right? Where you're not putting so much capital or so much money up front. If you're getting a service over time, maybe that's the way we should be going. But yeah, there's a lot going on, and hopefully that's exciting to everyone. I certainly think it is.
Well, it offers up different solutions, right? So there's going to have a lot more reciprocity in the relationship. If you think historically about MedTech, although chronic disease may be a little different, it's been an episodic point of care. Here's your device, here's your problem, I'm here, let me stand bedside clinically, I can offer some value, but then I'm gone. But now when we think about a lifetime value of a customer in an ASC, it's a different model.
Yep.
Right?
Yeah, it's a different model both in the setting care, it's a different model even the technology, right? So many things are moving more towards being connected devices, and so we're moving beyond the episode. And once again, that's much more patient-centric, like that's where we should be.
That's a pharma model, right? Because historically, MedTech has been, again, episodic. Pharma's been the lifetime engagement from a prescription model, but maybe we're moving towards a subscription model with the patient now, especially in chronic care.
Yep.
And we've never really had that model. In diabetes, you have that.
Yeah, we essentially do, right? Because we've got, as Abbott, we have a leading platform of a continuous glucose monitor where we've got over 5 million people around the globe who use our product, our FreeStyle Libre product every day. And it is a continuous wear model. Some people may use it more episodically, but generally speaking, it becomes part of how they live their life. It's their assistant, their support, their help.
So you have a head start in that RPM model because you've sort of seen some of those dynamics where maybe some of the other strategics may not have that baseline experience and lessons learned in that RPM.
Yeah,
model.
and I think we have that. We have the just all the digital capability and experience there, and then we also have that real focus on the consumer in a way because I sell directly to consumers. I mean, at the end of the day, a physician's writing a prescription for FreeStyle Libre. But you can see my advertisements and we engage them because people know they have diabetes and they know they want to live a better life and a full life. And we help them do that. But the ability and the capability around approaching consumers, engaging them in their healthcare, it's very different to most of our industry and the folks around this exhibit hall right now.
It scares the heck out of most MedTech companies to go to DTC. It really does. And what's interesting is I've watched that relationship now with Libre on the engagement with the performance-driven consumer, not the health management. So what I think it's Super Sapiens and some of the others, right, where we're now managing our glucose levels in order to have a better performing lifestyle. What are your thoughts about some of this MedTech leaking into just living a better life, not as a patient, but as a human being?
Well, hopefully we can help people ultimately prevent having diseases, right? And I think that is living a healthier life, right? And so it could be, we're actually just launching a product called Lingo, which is leveraging our Libre platform, but it's to keep people, healthy and keep them well. So it's giving the information they need to understand the language of their body and figure out like what makes you work. Is it my nutrition? Is it, do I exercise right after a meal? My sleep? All things that go into that. And we're doing the same thing as well with athletics. You mentioned Super Sapiens. We have a partnership there, and it's fascinating the role that glucose management will play in optimizing performance. Whether it be with world-class cyclists or marathoners. I mean, it has been extraordinary in terms of their training and performance. And that's just with glucose. We'll end up putting other analytes on there, like lactate, for example. And it's interesting. We were talking about heart failure earlier. Like lactate has a real meaning in the world of heart failure, which is very different than lactate in an athlete, right? And so those are all the things. It's an exciting time because we're going to move beyond just measuring one thing, but measuring multiple things.
Well, it's always impressive on the body of work that Abbott has brought to the medical device industry, consumer at large. What are you looking at for Abbott over the next 5 years from your vantage point? What's our focus? What are we going to really double down on as we look at the entire continuum in the company?
Yeah, I think it's continuing to advance the innovation and the leadership plays that we have, but really thinking about intervening earlier and preventing. So the things that we talked about, whether it be advanced analytics around, predicting people who might be at risk, whether it be for heart failure, whether it be for atrial fibrillation, I can go up and down the line in the portfolio. We're all better off if we intervene earlier and make sure people have access. And so I think that's for us as a big part of it, is making sure we continue to advance innovation, but then also driving access and earlier as well. And so that's making sure all the people in the world who could benefit from our products have the opportunity to do so. So we've got a lot of work to do, a lot of exciting stuff ahead.
Well, you've got the talented team to do it, so I do appreciate your time today and insights. And thanks so much for sharing. I know you've got a packed schedule, but thanks for sharing with our audience.
Yeah, thanks so much, Joe.
Always good, thank you. I'm Joe Mullings from the floor of MedTech Conference in Anaheim. Be well.